I'm honored to be up here with Senator John Hickenlooper from the great state of Colorado, and of course, Dr. Bill Cassidy, chairman of our committee. A big win today, 21-1. Our price tags bill comes out of committee. So patients deserve price tags, not surprise billing. I'm going to let Senator Hickenlooper kind of give a few opening remarks and not steal all the thunder that way. So John, go right ahead. I'm proud to be here with you.
Thank you, Roger. And I can't say a word without saying that Senator Marshall and his team has been incredible to work with. This has been a team effort all the way. And again, the committee staff under the leadership of Senator Cassidy, above and beyond any expectation. And, you know, good bills don't come out of nowhere. There's painful, long-term negotiation and compromise. And that's what this one came from. In Colorado, like in most of the country, healthcare has become increasingly unaffordable. The inflation over the last 25 years is 121%. That's almost 40% more than just the cost of living inflation. In 2025, so this most recent year, the spend on healthcare is $5.7 trillion. And I think that when you look at that, it has really bad consequences. People make decisions, they can't afford their insurance, they can't afford their health care. They go into a hospital, get us what they think is a simple procedure, and they come out impoverished. I think of it, people walking into a hospital blind and walking out impoverished. Right now, there are 100 million Americans, that's roughly 40% of the population, that have a total of $220 billion in debt, in medical debt. So these are people whose lives are being twisted and diminished because they've got the anxiety and the reality of insufficient health care. So I think the key is we don't know where the money's going. It's a completely blind system. Our bill lets patients know before they go in the hospital what it's going to cost. There are itemized receipts that's specified. Employers will have negotiating power. Again, if we think about it, there's 120 million people in America whose company pays for their health care. That company, and you can pick any company, let's say they have 40,000 employees, let's say they have 5,000 in Denver. They can't see what one hospital is charging versus what another is, what one scan costs versus what another scan costs. So that transparency will allow, in a very powerful way, those large employers to push prices down. Right, what we have right now is no one can see any of the prices, individuals, corporations, anybody. And what that means is not one industry is it a monopoly, but together they are what I've been calling an aggregated monopoly. The whole system is in a place where there's no price transparency. People don't know what the cost is. How are they going to lower the costs? You can't ever compete. So this bill puts real teeth into the penalties. I did an executive order when I was governor. President Trump did one in his first term, an executive order, as did President Biden. We've done executive orders. This will be the first time that we've actually had a piece of legislation with teeth in it that's going to make sure that this gets done. And if they aren't, there will be civil penalties for noncompliance. Hospitals won't be able to go out and collect debts if they are out of compliance. There are real serious penalties to all this. So, again, it's a corrupted, inefficient system that I think has been waiting for something like this bill. I'll turn it back over to you.
Thanks, John. Thanks.
Congratulations.
Yeah, thank you as well. $1,000 a month. That's what we think that this bill can save an American family. You have an average Kansas family, they're making $70,000 a year, and you give them $1,000 a month savings. That's real money. Certainly the number one issue back in Kansas, Colorado, Louisiana, the cost of living. And I think this is the bill. This is the bill that will actually make a difference sooner than later in the cost of living for folks. But patients do deserve price tags as opposed to surprise bills. Our bill forces transparency, it forces competition, and like Senator Hickenlooper said, there's going to be penalties if the hospitals don't comply with this. Could you imagine driving down the street, you need gas, and there's 4 convenience stores right there, and you're trying to guess how much is gas? in the healthcare system, they wouldn't not only show you the price, but you wouldn't even know after you filled up. You just basically give them your credit card, and then you'll wait 3 months and see how much they charged you for it. You know, the same thing. Could you imagine going to the grocery store and buying, you're at the meat counter. Shall I choose beef? Shall I choose hamburger versus steak? Shall I choose maybe chicken versus pork? And not knowing what the prices are. So just like every other industry, when you force prices, when you force transparency, when you force competition, it's going to bring the price down. And in our case, we think it's going to be $1,000 a month, and we think that's going to spill over. I think it'll spill over to Medicare, to Medicaid, all those other different payers. When they see those prices come down, it'll help those folks out as well. So I couldn't be prouder of our staffs. Again, John, thanks to you for your staff's work and for all your committee staff's work on both sides of the aisle as well. So Bill Cassidy, thank you for your leadership, and we'll give you the microphone here.
Thank you both. There is no way to lower healthcare costs unless the consumer knows the price. Period. End of story. There'd be no way to lower the cost of gasoline unless, as Dr. Marshall said, unless you're going down the street, you knew that this place was cheaper than the other. And so if we hope to decrease the cost of healthcare, and therefore the cost of health insurance, and therefore less out of pocket for the patient, it begins with price transparency. It's not the end of the story. It's certainly the beginning of the story. And by the way, it's critical not to make this too abstract. There's a family right now in my state of Louisiana, everybody's state, in which the child has a healthcare illness. They have taken them someplace and didn't realize that there was a facility fee associated with the x-ray that was ordered. There's $500 on that health care bill that they didn't know was going to be there, and the family doesn't know how to pay for it. And that sense of anxiety that wells up within you when you realize that this month's bills are not covered by this month's paycheck, and you put it on your credit card. Statistics are that people are carrying higher and higher credit card balances, and the percent of their income going to interest on their credit card has risen almost threefold. That tells you they're not paying their whole balance. They're paying the minimum amount. And credit card, medical bankruptcy factors into medical expenditures factor into 60% of bankruptcies. That's what this is about. Let's bring relief to that family who at the end of the month don't have the money to pay their bills. This is a way to begin to lower the cost of those healthcare bills to make them more likely to be able to pay. By the way, more likely for the family to be harmonious, more likely for the parents to stay together, more likely for the children to grow up in a two-parent household, and all the positive things that implies. This is an important bill. It is not the last step, but it is the first step, and it is a giant step for our country. With that, questions?
Yeah, I'll make 2 more comments. I was just thinking about the real life part of this. The average deductible in an insurance plan now is often $5,000, $7,000. And then after that, you're spending 20% out of your own pocket as well. So you're sitting there and you need an MRI of your knee. At one place, they're going to charge $600, and another place are going to charge $3,000. So that's why we think if we give patients the price tags, they'll be making those choices. And the customers, the competition will drive that cost of health care down as well. So with that, we'll stop and take a few questions. Go ahead. And tell us who you're with as well, if you don't mind.
Nancy Beer with the National Journal. Has Senate leadership indicated a path forward on the bill? Would it be passed as a standalone or attached to any vehicle?
Right. I think I'll let the chairman answer that question, but we're hoping with a nice package of bills that we have today, ours passed 22-1. I think we would love to see a victory for the American people. If you want to add anything to that, Bill.
We've not gotten a commitment yet from leadership, except to say that the House has passed a bill very similar to ours with a big majority. We passed it, I think, all but one person voting for it, and so a huge majority, bipartisan. And so in both cases, from across the political spectrum in both parties, we have people advocating for this. So I'm very optimistic that it will pass. I don't care if it's a standalone. I don't care if it's part of a bigger bill. I just care that it passes, and I'm confident that it will.
You know, Luck is as when preparation meets opportunity, and it just looks like the stars are lined up right now. That the folks back home are demanding we do something to bring down the cost of living. The White House wants something to happen. The House, the Senate, and this would be the #1 bill that could be passed, signed into law that would bring down the cost of living for all Americans. Go ahead.
And I assume this will happen in the fall, probably after the election. You got a bunch of other healthcare stuff that also has to move. So are there things in here that are not in the House bill that you really need to get? Like John James complained that this bill isn't part of the lower cost, more transparency, like the billing, the itemized bill, things like that, is not in there. Like what do you need to join in your bill and their bill?
Right. So, I hope we get it done before the election. I think that John and I would both love to see it done before the upcoming election as well. But if you think about what the House has passed, I would describe it as a base bill. It's something that we included in our bills, and then we've closed all the loopholes. Look, the previous executive orders allowed some type of estimates from hospitals, and they didn't work. So we closed that loophole. We require itemized bills. We don't want an estimate. We really want to know what an MRI of the knee is going to cost. And then ours has significant teeth to it as well. There's significant fines if the hospitals don't comply with this. So I think that those are the two main points that I would use. John, anything else that you were thought was a little bit better than the House bills? Or
Yeah, I think ours is a little more rigorous, and I think that I agree that we should get it done before the election. I think there are a lot of Democrats and a lot of Republicans who are going to want to get credit for this because it is something that is not just an immediate savings or will bring almost immediate savings to American families, but it is that threshold that allows us to get to much greater coverage. You look at the spends, $5.7 trillion last year. The American Medical Association estimates 25% of that is in bookkeeping and waste and all the inefficiencies. I mean, that's when you get down to it, that's $1.4 trillion a year. That's even after you allow 10% to be done for the normal administrative costs. That gets you, a third of that, let's say, goes to businesses, a third goes to individual consumers getting lower prices, but a third of it's going to go to government. And that's, north of $300 million a year. That's what you use to begin looking at universal coverage. And I think if you can pay for it in some way, I think most Democrats and most Republicans would like to see more of their citizens covered.
yeah,
Can I answer that?
you bet, Bill. Go right ahead.
Our version is more comprehensive, period, end of story. It gives employers full access to their data while maintaining strong patient protection. Your privacy is protected, but you have full access to data. And so now, if the employer says, I have a patient who went out of network, the provider billed $20,000, the insurance company the provider billed $100,000, the provider is paid $20,000, but I am billed by the insurance company $60,000. Okay, so the insurance company's taking $40,000 profit on that exchange. Then there was an account of that in the Wall Street Journal a year or two ago. That's exposed. The employer now knows exactly what the insurance paid for that out-of-network doctor, out-of-network provider. And so that is going to be huge for it. It also empowers patients to see costs. We require additional data from hospitals, labs, imaging facilities, and ambulatory surgical centers, including the discounted cash price, the negotiated rate, potential facility fees, and all other information for the patient to actually see their cost of care. Put simply, we require the actual price to be shown. Not just kind of how you get there, but in the Senate bill, this is how much you pay, boom. And that's powerful for the patient and powerful for the mama who's probably directing the care for her family. We require additional disclosures from insurance companies, including information about utilization management practices that can delay access to care. We require ownership disclosure. So if the insurance company owns a bunch of subsidiaries and you're getting your care all through the subsidiaries owned by the insurance company, we require that exposure. Why does that matter? It allows the federal government, state government, and academics to see if there's a conflict of interest in terms of how costs are being negotiated. When there's a lot of vertical integration, there's a chance to pad that cost. We have a transparency that's for the patient, for the business, and for government and for academics to be able to, as much as possible, expose what is the true cost of the care being delivered. That is the strength of our bill, and that's the contrast we have with the House bill.
Anybody else? That's great. Well, John, any closing remarks?
Thanks for all being here, and it is just a real pleasure and a privilege to work with these guys. It's something that's so obvious, and we've all know that the United States pays almost double per capita for our health care that is less effective. We don't have as long a life. We don't have as good a life. And this is the first step to getting, our fair share.
Yep. Thanks, John. Patients deserve price tags, right? There we go. Thanks, everybody. Thanks,
you.
Bill. Thank you.
Thank you.
Yep. Thanks.
Thank you, John.